All the slides presented here belongs to their respective owner. I or the channel does not claim any rights over them. Hello everyone, I am Shahan Laik. I am a third year MBBS student and today I will discuss about a very important topic, that is glaucoma. So what is glaucoma? Let us learn about the definition of glaucoma. Basically, glaucoma is a group of disorder which is characterized by increased IOP. IOP means intraocular pressure, abnormally increased intraocular pressure, and optic nerve weakness or optic nerve dystrophy. And also this led to tunnel vision, that is peripheral field vision loss. And this is a symptomatic condition of the eye, and when the IOP is greater than 25 millimeter Hg, then we generally called it glaucoma. And if you do not treat the glaucoma, it can cause permanent vision loss and permanent blindness can be caused. Now there are so many causes and risk factors for glaucoma, like genetics, it may be of familial history, aging, ocular hypertension, increased in intraocular pressure, severe myopia, that is nearsightedness, severe myopia patient. Also, if there is an eye trauma, and that can lead to increase in the ocular pressure. And sometimes after the ocular surgery, it can lead to pressure spike. So pressure spikes are actually the increase in the ocular pressure, sudden increase, sharp increase in the eye pressure. So basically sometimes after the cataract surgery and sometimes with medicine also this can increase. Other causes can be migraine. Sometimes migraine can cause severe headache and also development of glaucoma can occur. Black ethnicity like African Americans have more tendency to develop glaucoma than that of the whites. Prolonged use of any kind of local corticosteroid or systemic corticosteroid can also lead to increase in intraocular pressure, and this can lead to glaucoma. Diabetes patient has a lot of tendency to develop glaucoma because diabetes can lead to blood vessel development in the drainage angle of the eye. So proper drainage do not occur in diabetes patient because of the vessel development, and that is why there is a lot of intraocular pressure, and this led to the glaucoma formation. Now what about pathophysiology? Before learning about pathophysiology, let us learn about that eye has a special fluid within our system. You know it, that is aqueous humor. Aqueous humor is actually produced by ciliary process. Ciliary process that is situated in the base of the iris, that is ciliary process. And from the ciliary process this liquid aqueous humor are produced, and that circulates and moves through the iris, through the pupil, and moves to the forward chamber, and then it drains into the trabecular meshwork, and at last it goes or drains into the Sclems channel, and from there it is drained by the episcleral vessels, and eventually it mixes with the blood. So actually this increased IOP, increased intraocular pressure in the eye, is actually due to not proper drainage or decreased proper drainage of the liquid aqueous humor. So generally aqueous humor is properly drained. Aqueous humor is produced by ciliary process of the eye, and it is drained through the trabecular meshwork, which eventually drains into Sclems canal, and which will eventually go into episcleral vessel, and then it will mix with the blood. In this way the proper drainage occurs. But in case of the glaucoma, there is a problem, and because of that problem this accumulation of the liquid aqueous humor occurred in the eye, and that eventually leads to increased IOP. Now let me make you understand with the help of this picture so that you can understand it better. Now can you see this? There is something in the left side, the orange color, that is that has process, and that is actually the ciliary body. Ciliary body has this finger-like projection, you can see, that is ciliary processes. All this ciliary process will secrete a aqueous fluid that is known as aqueous humor. In this aqueous humor, you just follow the white arrow. You can see how this aqueous humor is going from just in front of the lens. It is going through the pupil, and then it is entering in front of the iris, and from there it will be drained through that meshwork that is there. The yellow arrow is pointing, that is trabecular meshwork. From the trabecular meshwork, it goes through that small canal, that is Schlemm's canal, and Schlemm's canal will eventually bring it to the episcleral vessels, which will then mix with the blood. In this way, this drainage occur. Okay, you can understand. From the first was the ciliary process, produce the aqueous fluid. From there, it crosses the pupil and goes to in front of the iris. From there, drainage through the trabecular meshwork. From there, it went to the Schlemm's canal, and from there, it goes to the episcleral vessels, and eventually it mixes with the blood, and this circulation is completed. Basically, in case of the glaucoma, either it can be the open angle glaucoma or close angle glaucoma, whatever it is. Eventually, it blocks the pathway, and a lot of aqueous humor is accumulated. It is not drained properly. So, because of decreased drainage of the aqueous humor, this leads to increased intraocular pressure or IOP in the eye, and that leads to glaucoma. This is actually another picture, but you can see there are actually two outflow track. Outflow track are two. One is trabecular outflow, another is uveoscleral outflow. Both are draining the aqueous humor. For making you understand, there are two outflow track. One is trabecular outflow, another is uveoscleral outflow. I have given this picture. You can see trabecules are the meshwork, and uveoscleral are a small track that goes between uvea and sclera, and it also helps in draining. Eventually, it goes into the episcleral or interscleral veins, and eventually it mixed into the blood. Now, what about the classification of glaucoma? Glaucoma can be classified into these two important types. One is congenital glaucoma, another is acquired glaucoma. Congenital means genetically there is defect, there is a gene defect, and that is why the baby is born with congenital glaucoma. Acquired glaucoma, it can be primary acquired glaucoma and secondary acquired glaucoma. Now let us learn about congenital glaucoma. Generally, because of the congenital defect in the angle of the anterior chamber obstruct the outflow of the aqueous humor. So because of congenital defect, the angle of the anterior chamber is obstructed. The angle of the anterior chamber is obstructed, and so outflow of aqueous humor do not occur properly, and there is a lot of collection of the aqueous humor occur, and this can lead to this can affect on the optic nerve, create pressure on the optic nerve, and this can actually leads to blindness. So in most of the cases, congenital glaucoma, when the baby is born, we need to do surgery. Now this congenital glaucoma can be a true congenital glaucoma, true, infantile, or juvenile. Three types of congenital glaucoma. One is true, another is infantile, another is juvenile. What is a true congenital glaucoma? In a true congenital glaucoma, it is labeled generally when the IOP is raised during the intrauterine life. So within the intrauterine life, the baby is having increased IOP, and the child is born with ocular enlargement. That is known as true congenital glaucoma. True congenital. Why the true means? Actually, the baby is having increased IOP when the baby was in the intrauterine life and the child is born with ocular enlargement. 40% case we see this true congenital glaucoma. Now what happens in infantile glaucoma? It is labeled when the disease manifests prior to the child's third birthday. So infantile means when the child is infant. Basically, after the child is born, this phenomenon is occurring, infantile glaucoma. So before the child has its third birthday, infantile glaucoma can be detected. And infantile glaucoma occurs in 50% of the cases. Now rest we have 10% who have juvenile glaucoma. Juvenile glaucoma occurs between 3 to 6 years of the age. And it is the same thing, but it occurs in latter phase of the child's life, 3 to 6 years. That is juvenile glaucoma. Acquired glaucoma. Acquired glaucoma can be of two types. One is primary and secondary. Primary glaucoma can be primary open angle glaucoma, POAG, and primary angle closure glaucoma, PACG. Now let us learn about primary glaucoma. Number one, or the most important, is POAG. POAG means primary open angle glaucoma, POAG. So what is POAG? POAG is actually the most common form of glaucoma. And in POAG, fluid drainage do not occurs properly and there is a fluid buildup, internal pressure of the eye increase, and this can lead to optic nerve damage and vision loss if not taken proper care. And exact mechanism is not known, but always remember open angle. The name open angle means there is an angle which is 45 degree between actually the iris and the cornea. We have an angle where actually the drainage occurs. So that is open here. So it is known as primary open angle glaucoma. But in case of the closed angle, the closed angle closure glaucoma, ACG, generally the angle is closed. So that is actually the differentiating factor between the POAG and ACG, angle closure glaucoma. Symptoms of POAG. Generally, POAG develops gradually and painlessly. So there is no initial symptom for POAG, but as the vision is normal in the early stage of POAG, but as POAG progresses, gradually the vision loss occurs and results in tunnel vision. You can see how the glaucomic patient will see. If POAG is left untreated, basically the peripheral or the side vision is slowly lost, and this will result in formation of a tunnel vision. Tunnel vision is a kind of defective sight in which the objects cannot be properly seen if we are not close to the center of the field of the view. And at last in POAG, eventually all the vision is lost and it may result in blindness. Now let us learn about ACG, angle closure glaucoma. Now it can be called as AACG, that is acute angle closure glaucoma, or primary angle closure glaucoma, PACG. So this is actually a glaucoma emergency condition. So angle closure glaucoma, ACG, is a kind of emergency situation where actually the iris itself block the drainage. The iris will itself block the drainage because the angle which must be there between the iris and the cornea, the wide angle, that is generally now closed. And this has resulted in sudden increase in intraocular pressure, and this will lead to severe eye pain. The patient will come with severe eye pain, nausea, vomiting, redness in the eye, and blurred vision. So immediate treatment of angle closure glaucoma must be done. Now, secondary glaucoma can be caused due to complication from other disease. It may be due to a eye injury, eye trauma, or diabetes patient, or due to steroid use, or uveitis or other things which actually cause this glaucoma. So from other disease, if glaucoma is caused, that is secondary glaucoma. Now, what is low tension glaucoma? In low tension glaucoma, low tension means normal tension. Low tension doesn't mean low, actually here normal tension. That is a kind of glaucoma which is generally not common. Low tension glaucoma is not common. There the eye pressure is normal. The eye pressure remains in the normal range, but the optic nerve is still getting damaged. So the eye pressure you check with the help of tonometry, it is normal, but the optic nerve is getting damaged. Exact mechanism of low tension glaucoma is not known yet. Basically, what is the diagnostic evaluation of glaucoma? For glaucoma to identify, it can be identified during regular eye examination by an optometrist or ophthalmologist with the help of ophthalmoscope, or with the help of the slit lamp, or with the help of other examinations, other optometric examinations, or the other different kinds of tests may be prescribed. And sometimes the patient give medical history and family history, all these, and also the risk factors. Sometimes you can tell that this patient is having glaucoma. The most important glaucoma test is done with the help of slit lamp and gonioscopy. So what is slit lamp? Slit lamp is a kind of special microscope that is there, where you put, you have seen in the ophthalmologist chamber, where you put your chin and see and keep your forehead on a certain kind of microscope, and the microscope has a high intensity light and a high power lens to observe your eyelids, to observe your lens, to observe the sclera, observe the conjunctiva and foreign bodies in your eye. So that is actually the special microscope that is known as slit lamp. By slit lamp examination, the patient, the doctor can understand the patient is having glaucoma. Another is gonioscopy. Gonioscopy lens may also be used to find out the drainage angle, how much angle is there. Gonioscopy actually measures the angle. Gonioscopy lens are used for measuring the angle of the drainage angle. So by these two methods, generally glaucoma can be understood. This is the picture where you can see the patient is being examined by the doctor in a slit lamp, where you put the chin. The patient is asked to put the chin and the forehead in rest, and the doctor, with the help of the slit lamp, it is a kind of special kind of microscope where he uses high intensity light and the special microscope to magnify all the structure, basically the lens, the sclera, the conjunctiva, the below the eyelids, everything can be examined. If there is foreign body also, that also can be examined by slit lamp. And a drop that contains a yellow dye is given, known as fluorescein. Fluorescein is given, that is, fluorescein is a kind of a yellow colored dye that is given in drops to wash away the tears. And generally sometimes additional drops are also given to dilate the pupil, and if the pupil get dilated, we can get a view of the retina. Another glaucoma test is tonometry. I told you tonometry is actually eye pressure measurement. So tonometer is a kind of instrument which will measure the intraocular pressure, the eye pressure, and that will eventually helps in understanding glaucoma. Now this is the picture where you can see how the tonometry procedure is done. This white color instrument is tonometer. Normal intraocular pressure range is between 12 to 22. Normal is between 12 to 22 millimeter Hg. So if it is greater than 22 millimeter Hg, then it can actually, you can say that the patient is having increased intraocular pressure, the patient is having glaucoma. Now for glaucoma test, ophthalmoscopes are also used. Basically, before using the ophthalmoscope, the doctor may give you some eye drops which will dilate the pupil, because if the pupil dilates, then the doctor, with the help of ophthalmoscope, will use a special kind of light which will go through the pupil and eventually falls on the retina, so you can get all the clear view of the retina. You can see the left side picture is the normal optic nerve view, and in case of the glaucoma, the right side picture, that is actually the doctor when this sees this kind of a suspicious optic nerve, then it may be a case of glaucoma. Nowadays, advances are made to make digital imaging of the retina, because digital images are more clear, crystal clear, and it will help us in understanding glaucoma very well by looking into the retina images. There is another method called color fundus photography. So what is color fundus? What is fundus? Fundus camera are actually the camera which will record color images of the interior surface of the eye. Basically, it will monitor or document the disorder. It will monitor the internal structure changes over time. Fundus camera, or we can say another fundus camera, is also known as retinal camera. These are the camera which take colored picture, and fundus camera use a low power microscope with a camera attached to it, and they are designed to take the photograph of the interior surface that include the retinal and vasculature, the vessels, the optic disc, the macula, and the posterior pole, that is fundus. So everything colored image you can get with the help of color fundoscopy. There are medical management also. We can give medicines or eye drops also. Like the medical management is, number one is beta adrenergic blocker. Beta adrenergic blocker will block the beta adrenergic receptor, and this will decrease the aqueous humor production. Example is timolol and betazolol. Timolol, betazolol are example of beta blockers. Beta adrenergic blocker, timolol and betazolol. There are cholinergic like the miotics. Cholinergic, also called the miotics, like pilocarpine and carbachol. Pilocarpine and carbachol are cholinergics which are used to reduce IOP, but this actually facilitates in the outflow of the aqueous humor. So beta blockers generally decrease the aqueous humor production, but pilocarpine and carbachol, cholinergics, they help in increasing the outflow of the aqueous humor. So we have these two options. Either we can decrease the production of the aqueous humor by beta blocker, or we can help in outflow. We can help in increasing the outflow with the help of pilocarpine and carbachol, cholinergics. Other eye drop is carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor. Example is dorzolamide. Dorzolamide, sometimes methazolamide or acetazolamide. So dorzolamide, methazolamide or acetazolamide, they also helps in decreasing formation of and secretion of the aqueous humor. So dorzolamide, methazolamide, acetazolamide, all these helps in decreasing the formation and secretion of the aqueous humor. Carbonic anhydrase inhibitor. Another is prostaglandin analog, PG analog, latanoprost. Latanoprost is PG analog, prostaglandin analogs, that is also used, latanoprost. That actually reduces the IOP by increasing uveoscleral outflow. That helps in increasing the outflow, the uveoscleral outflow. This is the picture. You can see how the ciliary body with the help of ciliary process produce the aqueous humor, and the outflow tract is of two types. One is trabecular outflow, one it can be trabecular outflow, another it can be uveoscleral outflow. So you can see there are two types of outflow. Now surgically there are also management like this one, ALT, that is argon laser trabeculoplasty. So ALT means argon, L means laser, and T means trabeculoplasty. So argon laser trabeculoplasty is used to treat open angle glaucoma, where generally a thermal argon laser are used to generally these laser beams falls on the inner surface of the trabecular meshwork. And why these lasers are used? To open up the intratrabecular spaces, and this will widen the canal of SLIT-LAMP. So the outflow tract will be increased. The outflow will be increased for aqueous humor, and this will eventually decrease the IOP. So argon laser trabeculoplasty is a kind of method by which we decrease the IOP. Another method is laser iridotomy. Irido, the name itself says irido means iris, and tomy means creating hole. So actually with the help of laser iridotomy, with the help of laser beam, a opening is made in the iris. With the help of a laser, a opening is made on the iris to eliminate the pupillary block, and this will eventually help in the outflow of the aqueous humor. This is the picture of laser iridotomy, where you can see laser beams, the green color laser beams are applied so that it can create an opening in the iris, and so the aqueous humor don't need to cross the iris like a mountain. It can just directly pass, just inside a mountain pass, just like it can pass, and it can go forward. So passage of the aqueous humor becomes easier by this method. Another method is cyclocryotherapy. Cryo means freezing. So basically freezing probe is applied to the sclera over the ciliary body, and this will, because of the freezing probe, some of the ciliary process are destroyed. You know, ciliary process is the part of ciliary body which actually helps in production of the aqueous humor, which produce the aqueous humor. So if a part of the ciliary process is destroyed, then aqueous humor will be less produced. So in this way we can control glaucoma. Now there is another method known as cyclodialysis. So what is cyclodialysis? Basically it is just like a dialysis method. Dialysis, you know, we do in the kidney. Basically small incision is done on the sclera. A spatula type of instrument is passed through that opening in the sclera into the anterior chamber, and create an opening in the angle. So in the angle an opening will be created. So it is just a kind of dialysis, but in the eye. So it is cyclodialysis. Small incision in the sclera is made. A spatula type of instrument is inserted to the anterior chamber, and this will create an opening in the angle. Another thing is filtering procedure. So what is filtering procedure? Generally for a chronic glaucoma patient, filtering procedure is used, and this is used to create an opening or fistula in the trabecular meshwork. So a opening is created or a fistula is created in the trabecular meshwork so that drainage of aqueous humor can occur. Trabeculotomy. This is another procedure. In this procedure of trabeculotomy, First, a partial thickness incision is made in the sclera. So there is a small incision that is made in the sclera, the white part of the eye, and then further some section of sclera is taken out to produce a opening for the aqueous humor outflow under the conjunctiva. So within the conjunctiva, just under the conjunctiva layer, a bleb is formed. That is a filtration bleb. You can see the bleb picture that is produced, that is created just below the conjunctiva layer, and this bleb will actually helps in the outflow and collection of the aqueous humor. So in this way, trabeculotomy is made. Another method is sclerectomy. In sclerectomy, there also a partial thickness incision is made in the sclera, and one or more openings are made with a punch, and at last a flap of sclera is covered. A flap of sclera is closed over the punched holes. So that is sclerectomy. That is also another treatment for glaucoma. This is latanoprost. This is a prostaglandin analog. This is used as an eye drop for treating glaucoma. This is dorzolamide. Dorzolamide is a kind of carbonic anhydrase inhibitor. That is also ophthalmic solution 2%, is used in the treatment of glaucoma. Timolol is beta blocker, beta adrenergic blocker. That is also available as timolol malate eye drops, T-lol, which is used in the treatment of glaucoma. This is pilocarpine hydrochloride ophthalmic solution, which is cholinergic, which is used in the treatment for glaucoma. If you like the content of our channel, please subscribe our channel, and if you think it is useful, please make a thumbs up. You can suggest me in the comment section, and you can also follow our channel in Instagram @Medico Shahan. Bye bye.